Good morning, everybody. I'm so pleased and grateful that New South Wales has already hit the 6 million jabs. And Dr. Chant and our team had conversations this morning about what's possible now because we've hit that milestone, and I look forward to making that announcement on Thursday or Friday this week as to what fully vaccinated people will be able to do from the month of September because of the target that we've set. So thank you to everybody who stepped up and got the jab. That equates to about 60% of our population across the state having at least one dose, and around 32% of our population double dose, which are amazing milestones, and I'm so deeply grateful. In the last 24 hours, 138,000 tests of COVID were done, and so thank you again for people coming forward. We have 753 cases of community transmission, and fortunately no deaths to 8 p.m. last night. The suburbs of concern remain Auburn, Merrylands, Yagoona, Guildford, Bankstown, Punchbowl, Blacktown and the surrounding areas, and we're really asking people in those communities to be extra careful. Assume every time you step out the door that you have the virus, or that anyone you come into contact with has the virus. In terms of the regions, many areas are settling down and stabilising, but Western New South Wales, of course, remains our concern, and Dr. Chan and the Deputy Premier will further talk about that. In relation to the vaccine rollout, I want to call out some communities who've had such a jump in the rates of their vaccination. A deep thank you. Blacktown has done an amazing job. Burwood, Fairfield, Canterbury and Bankstown, these suburbs have gone to very low vaccination rates, to some of the highest in the state, and we're incredibly proud of all of you. And in having said that, we are now calling on everyone between the ages of 16 and 39 to come forward and book to get your vaccine through newsouthwales.gov.au. We want to make very clear, if you come through the New South Wales Health website, newsouthwales.gov.au, in those 12 local government areas of concern, you will be guaranteed priority to get your jab in the next few days. So please make sure if you're aged between 16 and 39 you do that. Susan Pearce, who's the Deputy Secretary of Health and who runs our vaccination program, is here to talk about that further. To date, we've received nearly 300,000 bookings of people in that age group, but we want to see more. So please come forward and get vaccinated to keep getting those vaccination rates up in those areas where we've got the highest virus rates. There's no doubt that the more people that are vaccinated, the greater impact that will have on reducing the spread, but also keeping loved ones safe, and that's very critical reasons to come forward and get the vaccination. So thank you again for reaching that great milestone, and Dr. Chant, myself and the team will look forward to speaking about what you can do in September and October if you're fully vaccinated, the additional thing you can do, but also to outline what schools will look like in the next little while as well towards the end of the week. Dr. Chant will now give the health update, the Deputy Premier will talk about the regions, and Susan Pearce from Health will talk about the vaccine program and some exciting initiatives we have to incentivise people to come forward on the weekend to get vaccinated. Thank you.
So there were 753 locally acquired cases reported in New South Wales for the 24 hours to 8 p.m. last night, and 2 cases of overseas acquired infection. There were 138,472 tests. We have 107 cases in ICUs, and some of them across the age span. So again, reinforcing that COVID is a severe disease and can impact all age groups. Of the 107 people in ICU, 95 are not vaccinated, and 12 people have had their first dose of COVID vaccine. Again, the vaccines are highly effective, and I do urge everyone to get their 2 doses as quickly as possible. 1 dose provides protection, some protection, but it is critical that you get your 2nd dose in the agreed framework. And I have requested that people who have received AstraZeneca strongly discuss with their GPs bringing forward their interval to that 4 to 6 week in the current outbreak context. As the Premier said, that we did not have any deaths reported in the 24-hour period to 8 p.m. last night. Overall, and the Deputy Premier will describe the situation in more detail, but clearly we have a strong focus on our communities in Far West and Western New South Wales. It is critical that those communities follow the public health advice and also take up the opportunity for vaccination, which is being increased access points throughout the regions. Newcastle is settling, and I just want to thank the response in that region to the public health advice. It still is important that we stay the course there to continue to dampen down any transmission. In terms of other parts of the state, clearly the focus remains in southwestern Sydney and Sydney. We are seeing some cases in Sydney and also the Western Sydney local health district. So those existing suburbs that the Premier indicated, the particular areas are Auburn, Marylands, Yagoona, Guildford, Bankstown, Punchbowl, Blacktown and surrounding suburbs. So my key messages is we need to hold the course. I understand that everyone is fatigued and tired, but it is incredibly important that as we increase vaccine coverage, we do all we can to prevent further transmission and that we continue to see those case numbers decline. And that is our challenge. And can I thank the community? It is so pleasing every day to see those vaccine numbers go up. And what is more pleasing is to see those second doses start rate to go up as well. So please come forward, get your first dose, get your second dose, but it is critical across all the age groups. But unfortunately, on a sad note, there are still many people over 70 that have not received their first dose. And so if you have a loved one that's elderly, please, there are so many access points for vaccine at the moment, please assist them to get a vaccine. Thank you.
Well, good morning. And Western New South Wales continues to be an area of concern with 36 cases overnight. 23 cases were in Dubbo, 5 in Parkes, 2 in Bourke. In the Wellington local government area, there are also 2 cases. Cadamble 1, Gilgandra 2 cases, and 1 in Narromine. In the Far West local health district, as of 8 p.m. last night, 14 cases in Wilcannia. And again, our message to anyone that has visited Wilcannia or is in Wilcannia is to get tested, regardless of symptoms or not. We need to get on top of it. It continues to be an area of concern in the Far West, and we'll continue to focus on that. In the Hunter New England LHD, there was 1 new case, and that was in the Newcastle LJ, and that was previously attached to the aged care cluster. The Illawarra Shoalhaven area, once again, there was 3 cases this time, all 3 cases in the Wollongong local government area. Central Coast, also 3 cases. But today I also want to call out in relation to vaccination in the regions. We want to keep vaccination rates high. We want to keep up with what's occurring in Sydney, and we want to also make sure that we have access points in areas in regional rural New South Wales that are falling behind. But today I want to call out areas like Walker, who have got now a 49.2% double dose rate, a 75% single dose rate. Edward River, 41% of a double dose rate. In Hay, 40% of that population has double doses. And the biggest mover for the week was Gilgandra, that went from 22.5% first dose to 51% in under a week. So again, congratulations to those regional communities that are getting on the vaccination program. We've got vaccination points, our GP network, our pharmacy network, and of course New South Wales clinics. I know we're using a number of mobile clinics across the regions. We're having vaccination days in regional areas in those smaller communities. We've seen it in Armidale, we've seen it in Verrell, and shortly in Moree. And again, to everybody, please get vaccinated. Those days are normally not a book-in arrangement, but please get on the New South Wales website and book in for your vaccination as we continue to strive to get to 70 and 80% in the regions.
Thank you, Deputy Premier, and good morning, everyone. It's really great to see the bookings in the 12 LGAs creeping up to 300,000 now. Also today, to make it clear, for disability workers and childcare workers who live or work in the 12 LGAs, we have a link for you that will give you priority access to our vaccination clinics to assist you to get your first dose of vaccine, which is required by next Monday, and there is plenty of capacity. As we said earlier in the week, we still have well over 200,000 spots available for people in those 12 LGAs. Please do not delay. Make your booking today. It is my plea to you. We have this opportunity to do this great amount of vaccination across those LGAs, and as the Premier has said, They have all lifted substantially, and there's nothing like a little bit of healthy competition amongst our communities to see who can get to the highest rate the fastest. To assist, to put a little bit of a light-hearted note on this, we've partnered with the major sporting codes who will, in due course, in the next day or two, make their own announcements about this. But on Sunday of this week, for the 12 LGAs, we urge anyone who follows the rugby league, the rugby union, soccer, basketball, netball, etc., wear your team colours to the vaccination centre, particularly Kudos Bank Arena, One Fig Tree Drive at Sydney Olympic Park and Macquarie Fields all have bookings available for Sunday. Wear your team colours, take a selfie on the selfie wall as you're leaving, and the sporting codes will be announcing a competition to see which code can get the most vaccinations completed. New South Wales Health will also provide a vaccination championship cup. It does feel like the Olympics of vaccination for us at the moment. We're very keen for people to do whatever it takes to get those doses into arms, and we look forward to seeing everybody have a little bit of fun while they're at it. Thank you.
Premier, could the curve actually be bending, firstly? And secondly, you nominated an 80% figure even prior to the Doherty modelling. On what advice did you do that? And in Israel, I think Clinton asked a question about this last week.
That's 3 questions so far, Andrew. I won't remember them all. Can I do the first 2?
78%, there's 120 deaths a week. Is that what we might see at 8?
Sorry, what was the first part of the question?
Could the curve be bending?
Oh yeah, look, we always say there is no way you can get a trend from a day. And what we're focused on is, again, I don't want people to ride the roller coaster of emotions on the case numbers every day. Let's get focused on the vaccine rates, because that is what will determine how we can live moving forward. In relation to the 80% adult population, we have the best, I believe, best medical officer in the nation. Dr. Chant gave me that advice months and months before the Doherty report came out, about 80% double dose in the adult population, and that is why we based our 6 million target on, to say that once we get to that number, we can at least provide an additional support to our communities. So we pride ourselves in New South Wales on always relying on the health advice to make our public policy decisions. And that's the advice that I received some months ago, and that's why I think I was the most enthusiastic participant in the Doherty discussion in National Cabinet, because that was that validated certainly the advice that I'd received. And I'm looking forward to New South Wales hitting those targets. I'm incredibly proud in which, during our darkest times, everybody's really coming forward and doing the right thing. And to have so many people who otherwise may not have wanted to get the vaccine to come forward and get vaccinated has really lifted our spirits. And again, this morning, Dr. Chant, myself and Deputy Premier and others were discussing what we can announce on Thursday or Friday to allow our citizens to have that extra degree of freedom in the next little while, which we're looking forward to do. And obviously, once we get to 70% double dose and 80% double dose, we'll also look forward to obviously living much more freely than what we are today.
But Israel, the 120 deaths a week with 78% coverage.
Oh, look, we would never ever put a number on anything like that. Obviously, our first and foremost priority is to protect human life and to live as freely as possible while we do that. But we also have to accept that there's been no state or nation on the planet that's escaped the Delta strain, that's escaped having cases, and we just have to be real about that. It is confronting, it is scary, but that is the world we're in. That's why we're in a pandemic. It is a plague, a contagious strain of a contagious disease which is sweeping the world, and Australia has done very well compared to the rest of the world. I know that's hard to say when we're going through perhaps our most difficult times here in New South Wales, but we have done incredibly well compared to other parts of the world. The fact that our effective is around 1.3, or what I should say is the fact that only that is the rate at which people are passing on the virus at this moment. Obviously, we want to see it come down below 1, but in many places around the world, it's between 7 and 9. In places where there are some restrictions. And I'm looking forward to us moving forward as a nation, because every state, no matter what stage every state is up to, some states have 0 cases and border closures, but every state's going to have to come out of that eventually. And when they do, they're all going to be confronted, perhaps not as starkly as New South Wales is. We're the largest state, most densely populated, most diverse, and Victoria has similar demographics to us. So it only stands to reason that we're the first two states that are confronting the reality of the Delta strain. But other states are going to have to go through it. Other states who've had 0 cases for a long time, when they do open their borders and welcome international travel, welcome people from other states, the Delta strain will take hold, and that's why it's important to be prepared by getting those high vaccination rates, making sure the health system is in place to deal with that.
Premier, why are you so determined on vaccination centres? Blacktown is a hotspot. There is no major hub, no mass vaccination centre there, and it's a long way from Sydney Olympic Park and even Penrith. Can you open something in Blacktown?
But I called out Blacktown because it's the area that is doing the best in terms of vaccination rates. Obviously, people are getting access to the vaccine. We've seen Blacktown go from one of the lowest rates of vaccination to now one of the highest in the state. Thank you to the people of Blacktown for coming forward and getting the jab. And across the state, we have more than 100 access points set up by New South Wales Health. We have our great GP network, our great pharmacists, and during the course of the next few weeks, you will see us give you direction as to where you should go to get your vaccine. So as different categories of people are invited to get vaccinations as a priority, we'll make sure we give you advice as to where the best point of contact is. And we're really pleased about how the rollout's going. And can I say thank you again to Susan Pearce and everybody at New South Wales Health. They're doing hundreds of thousands of vaccinations through the New South Wales health system on top of managing the hospital system, managing the pandemic, managing the testing. So it's a big load New South Wales Health is bearing, and we do it with great pride. They do it with great pride, and we thank every worker in the system for the role they're playing. But what we've seen really in a very pleasing way is the 12 local government areas of concern and all the suburbs within them are now having some of the highest rates of vaccination, and that is something we should all feel really positive about, because it will help us control the spread. It will also help obviously reduce hospitalisation, protect life, but also give opportunities for people in those areas to know that even though they're going through a very difficult time with the additional restrictions, that there will be opportunities for us to look at what we can provide in the future.
Why are you so determined to give us this one freedom now, given case numbers are a lot higher than when you first made this promise? And how can you do it in a manner that's fair to all industries and all members of society in Sydney?
Because higher rates of vaccination do give us extra protection. And we don't ever want to have to burden our citizens more than we need to, and that's really important. Of course, health and safety comes first, but we also need to consider mental health, we need to consider livelihoods. There's a whole range of things you need to consider. And I think it's a wonderful opportunity to say thank you to the people of the state who really stepped up and in a very short amount of time. I mean, we're not exaggerating when we say New South Wales has, if not the highest, one of the highest vaccination rates now in the world in terms of how quickly people are getting vaccinated. And that's something we can be proud of and something that we believe will give us extra protection. So we're very keen to make sure that we do everything in a safe way. New South Wales will never compromise the health and safety of our citizens, but we also have to accept that every stage of the vaccination process, we've now got 60% of our population with at least one dose. That gives you a certain level of protection. In some parts of the world, they're essentially living freely with these rates of vaccination. We're obviously more conservative here. We want to make sure we control the virus to the extent we can. We don't have more hospitalisations than we need to. We protect human life, and that's why we're taking the approach we are.
You're promising that people who are vaccinated will get one extra thing, from September, days after you've imposed restrictions on 12 areas of concern that you've previously said wouldn't do anything to stop the transmission of the virus. Can you guarantee that people in the 12 hotspot areas will get one extra freedom along with everyone else in Greater Sydney? And if not, are we still all in this together or not?
We're having those conversations now.
We're hearing.
I'm sorry? Sorry, these people first. Yes, sorry.
I know, but we didn't get an answer to that question.
Premier, will people in the hotspot LGAs get a little bit of extra freedom like everyone else in Greater Sydney?
With all
or
due
not?
respect, I did answer that question. I said we're having those conversations now.
So is it possible that it won't be?
We're having
even?
those conversations now. Yep.
We're hearing reports of ramping outside of hospitals, 3 major hospitals
I'm sorry, I
overnight.
didn't get the first question.
We're hearing reports of ramping at major wait time delays of people waiting in ambulances. So 6 hours outside 3 of the major hospitals last night, up to. Are you sure that the hospital system is coping, and why are we seeing these delays creeping up here?
Well, look, Dr. Nguyen was here yesterday. She's one of the key specialists that's in charge of, or part of the team that monitors all of our hospital capacity across the state. We're in the middle of a pandemic. There's no doubt the system is stretched, but you'd expect that. But it's coping very well under the circumstances. And even when you're not in a pandemic, you'll often have issues where things go wrong in the health system. But to have a pandemic overlay everything else obviously makes that stress even more. But all the advice I'm receiving is that the system is coping well, that the system is working as one network, that people are really chipping in from all across our different local area health districts to support one another. But please know, we have a very large and complex system that sometimes suffers stress even without a pandemic. And especially during these months, these are the months normally you'd find our emergency departments or other places full of people with the flu or other serious disease during this time of year. So August, September, October tends to be the most challenging time of year for our hospital system regardless. But when you overlay that with a pandemic, of course you're going to have stress in the system. But all the reports I receive is that the system is coping well, that all the specialists are supporting one another, all of our health workers are supporting one another and being very flexible, and we're deeply grateful for that.
Premier, can I just ask you, the Doherty report talks about what happens at 70%. 385,000 cases, 1,500 odd deaths in the first 6 months. About a third of them will be in New South Wales. Dr. Chance just said it's a very serious illness. Will you undertake to give us some modelling on what you think will happen in New South Wales, and also how the hospital system will cope, particularly in regional Australia?
Yeah, look, all that work obviously goes on an ongoing basis, but the last figure I looked at was the rate of hospitalisation is around 5.5% at the moment. So obviously the case numbers determine what the capacity constraints are, but know that when we started the pandemic, nearly 2 years ago now, or at the beginning of the pandemic, we quadrupled our intensive care capacity. Now, we're nowhere near needing that. But please know that back then we have 2,000 ventilators, and at the moment Dr. Chance read out how many people are on ventilators. It's far less than that number. So we have 2,000 ventilators, we have quadrupled our intensive care capacity, our surge capacity if required. We're hoping we won't be required, because we're seeing even now with case numbers where they are, the hospitalisation rate is very, very low, and that's because a lot of people who have the vaccine are protected from being in hospital. And as Dr. Chant said, regrettably, the vast majority of people, I think out of everybody in ICU, only 12 had received 1 dose of 1 vaccine, and everybody else had 0 vaccine. So it's obvious that those that are vaccinated are protected, which is why some time ago, Dr. Chant and I said, let's get vaccinated, increase the rates of vaccination, because that is an obvious protection. So those scary numbers don't have to come to fruition if the majority of our population is vaccinated.
Premier, there are 600 people in hospital with COVID. The Doherty report was predicated on 30 to 40 cases. Now, the Doherty Institute has said that if you open up at 80% vaccination rates with a higher caseload, you'll still reach the same peak, but you'll get there more quickly, which means that the hospitals will continue to be overwhelmed with COVID. They're already stretched.
But we know for a fact that we have the capacity to manage that, and also, yes, and also, absolutely we do. But also, please know that because we've seen a number of people succumb to the disease, it's highly unlikely, especially once they're vaccinated, they'll succumb to the disease again. I'll get Dr. Chant to talk about that. But in essence, when you've had this number of cases, it actually, with a high rate of vaccination, it allows you to completely manage what will happen beyond that point. And in fact, at least we are ready to confront whatever comes our way, as opposed to other states who've not had to deal with this at all. So when they open at 80%, they're going to have to make sure they've got capacity and are ready to deal with these issues. But I will ask Dr. Chant just to explain this important point about the fact that once you have 80% double dose vaccination, coupled with the number of cases that have already been in the community, the rate of hospitalisation can further decline rather than increase. But I'll get Dr. Chant to explain that from a medical perspective.
So I think we're dealing with a number of concepts. So at the moment, the Doherty report we are in a lockdown. We are in one of the tightest lockdowns New South Wales has ever experienced. What we are trying to do is use vaccination as an additional tool to reduce the R effective. So reduce the fact that everyone at the moment is infecting more than one person. And when you infect more than one person, you grow the case numbers. We don't want to see that occurring. What we want to see is declining case numbers. Now, what we know is that with the Delta strain, and because of the pattern of spread within households, that every time you get to a household, everyone in that household is infected. We know that also you're more infectious in workplaces, so you generate workplace clusters more than you would have with the previous strains. So the way to stop that cycle is to vaccinate key people and to get those vaccination coverage levels up very high. The first priority we've had is protecting our aged care facilities. So the mandating of vaccination for all our aged care workers. And I think, you know, one of the glimmers of hope in this has been the fact that we've had a number of aged care exposures, and it's been pleasing to see that we haven't seen the death rates in our aged care facilities that we've seen in earlier phases, where we've seen tragedy in those aged care facilities. Point. The next one is disability workers. We want to protect our most vulnerable and make sure our disability workers. We want to vaccinate people that are in critical industries where they have to function, they have to keep going to work, because we can't stop them moving in a restricted environment, because otherwise our food supply will fall down. This is the whole basis of our targeted immunisation strategy. And so can I just echo what Ms Pearce said, is this is your opportunity for those LGAs to have access to a beautiful experience in getting vaccinated. You will help us. So in terms of the Doherty modelling, what they're saying is around 80%, you have options and choices. It's not to say you're not going to have to calibrate and respond. Your level of restrictions, what you permit, it may be that we actually have indoor mask wearing for years in certain settings. We may have factors that you're only permitted to go to certain high-risk venues if you're vaccinated and show proof of vaccination. The world is grappling with how we coexist with COVID, and this virus may throw us curveballs. There may be, you know, we've got the Delta variant. God help us if we have another variant. So we need to be, this is not a one size fits all. The other issue I'd like to say, and this is a really key point, we are only as safe if we protect our vulnerables in our community. And our vulnerables, I use the definition, are of our aged care residents, our disability home residents, but they're also the people that live in large households that have to go to, don't have the option of working from home, that have underlying health conditions, that have complex interactions, maybe live across multiple households. We have to protect our mental health, our drug and alcohol patients. We have to protect our people in the criminal justice systems, our correction settings, our juvenile justice. So my 80% means that I want a strong equity focus across that vaccination coverage, and we need to have it very high across the population uniformly. Otherwise, we're going to see.
The whole state? Is that the whole state too, Dr.
Sorry?
Is that the whole state, like regional
So
and
what
rural
we're
as
looking
well?
at now is the focus of our vaccination strategy has been to lift the inequity in vaccination coverage. If you look at our chart, and I just ask the community to go back and see where we were and where we are. You know, the fact that we've got Blacktown at such a high level, there's room to move. I would like to see some of those LGAs and these initiatives will lift them even further, which will help us get control of the spread of the disease. But we need to also make sure that we've done a vaccination in our social housing, we've vaccinated all of our disadvantaged communities, our homeless communities. So be assured that whilst we don't talk about that, our local health districts are doing a lot of work with our Aboriginal communities, with our homeless, with our disadvantaged groups to actually get vaccine coverage there, because I need high vaccine coverage there
and high vaccine coverage overall, because I think COVID has taught us that it seeks out areas with socioeconomic disadvantage.
Western New South Wales, just on the need to mandate about that. Just on Western New South Wales talking about that. How successful have you been in terms of lifting that vaccination rate? And just in terms of cases, how many cases in Western New South Wales are now in the Indigenous people there, and what's being done? Especially how sick are people out there?
Well, Susan Pearce can talk to the massive effort out in the vaccination, but that's been a real priority and a cooperation across all levels of government. And can I just acknowledge that it's a real partnership between the GPs, primary health care, but the Commonwealth and the state. And I really appreciate that, because vaccination and the speed of vaccination there will really mitigate any risk, and what we're trying to do is ring fence those rural remote communities so that have high vaccination coverage.
Just before that, just answering, what's happening on the ground there? How sick? There's a number of cases there, in Wilcannia, and has anybody had to leave the communities for extra healthcare, or what's happening on the ground there?
Certainly, we have cases that are requiring intensive care in Dubbo. Clearly, we're very watchful in supporting clinical services into Wilcannia. That community. So probably the Dubbo community and the Wilcannia community are our key priorities in that area. And we are urging the community to respond. So everyone has to do their parts. Vaccine is accessible in those communities, and I do encourage you to go and get vaccinated in those other sites like Parks and Mudgee and Bathurst. We've had positive cases in a number of those communities. It is critical that everyone takes up vaccination. But Ms Pearce can talk about the great initiatives.
We're seeing a strong uplift in a lot of those rural LGAs, which is really pleasing. From yesterday, there's a plan rolling out across Western New South Wales in particular, going to a large number of small communities. So over a period of 3 weeks, first dose, and then they'll return and do second doses weeks 4, 5 and 6. That effort's being supported by our Aboriginal community controlled health organisations, the RFDS out in Wilcannia, for example, the ADF, AUSMAT and our local health district. So a great partnership model. I even noticed yesterday that there had been a community-led model in Armatree in Western New South Wales at the local pub, where the community had come forward for vaccination there. So our rural communities are responding really incredibly well. We've sent vaccine supplies, obviously, to Western New South Wales to further support them, as have the Commonwealth. And we will continue doing that until we get as much coverage as we possibly can. No one will be left behind in this vaccine rollout.
Sorry, we're just hearing that there's been a fatality in a house. We're hearing a fatality in a... about the key critical groups that need to be vaccinated. Surely teachers are going to come next. Will you make it compulsory for teachers all across every sector to be vaccinated?
Well, we already have appealed, obviously, to everybody between the ages of 16 to 39 to come forward and get vaccinated in those local government areas of concerns in all those suburbs there. We also know through various means that there is already a high take-up rate of teachers that are vaccinated. And when we outline our schools plan towards the end of this week, we'll be able to talk about that.
So you may consider that, because obviously the future of schools opening up, really, for the safety of kids, is going to be predicated on them being able to ensure that their teachers are vaccinated as well as children if they can't be.
I'll just make this general statement. It's fair to say that in all categories of workers that we've encouraged back to the workplace, we've said you have to be vaccinated, and that's for the broader safety of the people they interact with and the broader safety of the community. But I don't want to preempt what we say about schools until later this week. There are obviously conversations being held with stakeholders and with various sectors, including the independent and Catholic sectors as well. And we're working on our plan as to what school looks like coming back. But there's no doubt that in the future, as Dr. Chant said, we can't assume that many private organisations for a long period of time might say you can only come to my premise, or you can only fly on my plane, or you can only do X, Y and Z if you have the vaccine. And that's why New South Wales is also developing technology which will allow us to check in and show our vaccination status all in the one go. So my message to everybody is, if you want to get back to normal, please get vaccinated. Again, it's your choice if you don't, but we can say in the strongest possible terms, if you want to do certain things in the future, vaccination will be key as part of that process.
In the discussions that you're having about schools and about the freedom that we're going to get, if Dr. Chance says she's not comfortable with sending children back to school until they're vaccinated, and if Dr. Chance says that she doesn't feel that we're ready to give her freedom, are you going to go ahead and do it anyway because you promised it?
We have never ever taken a decision in New South Wales which is completely contradicts the health advice. That's not what we do. And Dr. Chant and myself and key members of our team have been having these conversations for some weeks about what is safe to do. And please be assured that we would never ever make an announcement unless health had a degree of comfort with that.
Are you going to
some of these rural communities like Wilcannia, if some regional towns come out of lockdown, have you considered lockouts like we saw in Queensland and the Northern Territory, where you prevent people from travelling to those really tiny vulnerable towns until their vaccination rates are higher?
Oh, look, we're considering all the options as to what life might look like moving forward. But I don't want to really say too much yet about what regional New South Wales will look like until we get that advice. But I think it's fair to say that the greatest protection we can offer any person during the pandemic is vaccination, and that's why
something you're looking at, though?
it's not something that I've heard of. It's not something that we've looked at this stage.
Premier, how many teachers are currently vaccinated, Premier?
Why should a fully vaccinated hairdresser with a fully vaccinated client be allowed to operate, but a fully vaccinated restaurant worker not be able to serve a coffee to a fully vaccinated customer?
Well, look, obviously there are complex policy decisions that we need to go through, but when you're obviously trying to prevent any super spreading events, there is greater risk attached to one person having contact with multiple people. So there are obviously settings that are more high risk than others, and that's where Dr. Chan and her team give us the advice. They advise us on what are the lower risk settings, and as we've already stated, not only are we considering Dr. Chan's advice in relation to the extra freedoms that might come our way, which is obviously critical, but we've also consulted, the public health team's also consulted the chief psychiatrist to make sure that he gives us his advice on what are the most important things in terms of a wellbeing and mental health perspective people want to do. And then what we do is reconcile that with Dr. Chan's advice on what is low risk activity. So every decision you take moving forward has to be based on a number of things and has to be based on the best advice. And that's what we've always done in New South Wales. And you know, everybody judges every decision we make, and that's fine. But please judge us at the end of this process and look back and say, did we do our best at every stage to keep the community safe but also offer freedoms? Because every state is going to go through this in their own way. This is the way New South Wales is dealing with this as the largest state, the most densely populated state, the gateway to the nation. This is how we're dealing with it, and but we deal with it with the best advice available to us.
Dr. Chan, we're hearing about I don't know how many teachers are vaccinated, because the Deputy Secretary, or the Secretary of Education rather, Georgina Harrison, told the COVID parliamentary inquiry that they didn't know how many teachers had actually been vaccinated.
We have Education Department has voluntary processes which allow them to make those assumptions about the rate of vaccination, and I'll have more to say about that towards the end of the week.
You've got construction workers out there, you had your supermarket workers' day. Is it not time? There are reports you might be sending year sixes back or kindy in the papers fourth term. Shouldn't you be acting now to make sure all teachers are vaccinated?
Well, firstly, we've invited teachers, and we've invited everybody between the ages of 16 and 39 already in those local government areas of concern to come forward and get vaccinated. But also know there are a number of very good vaccines available. So we're asking everybody to come forward and get vaccinated, especially if you work in an occupation which has contact with a lot of people. So there is already a call out to teachers as well as every other frontline worker. Every other worker who has contact with people, we're urging to get vaccinated. Obviously, our focus is to lift the rate of vaccination in those communities where there's high circulation of the virus, because that protects human life, keeps people out of hospital, reduces the spread, especially people who have to physically work outside the house. And so what you have to do within a pandemic is prioritise those areas of concern, prioritise where you're putting the resources, and have a very targeted approach. And our health officials have been in touch with officials in places, in provinces in Canada, for example, where they had a similar targeted approach and saw vaccination rates lift and case numbers go down. And certainly we have a very targeted approach, but every teacher, every frontline worker, anybody who has contact with other people in their occupation should be coming forward to get vaccinated.
Regarding the strain on public hospitals, Westmead Hospital, we've been told by surgeons, they're cardiac surgeons, that the theatre list has been halved because beds are being put aside for COVID. They're concerned some of their patients will suffer heart attacks while they're waiting, potentially die. Can the private sector be involved as they were last year with taking some of that overflow?
Well, obviously, we're already working with the private sector in relation to those matters, but please know that anybody who needs medical attention in New South Wales will get that attention. And we know that some hospitals do have greater pressure on them than others, obviously in the southwest and west, and that's why Dr Nguyen gave some very good feedback from Nepean Hospital where she works, where she's involved. So there's no doubt that our hospitals in southwest and western Sydney have the greatest pressure because that's where the majority of cases are. But we're also in a good position where we're managing capacity, managing these challenges. Our system is tested in the best of times, least of all in a pandemic, but given all things considered, we are managing the system well and making sure people's health needs are met.
Tanya Davies has continued to criticise the government's vaccination push for certain authorised workers. She's now criticising the speed at which New South Wales wants to get to 70 and 80% double dose of vaccination, suggesting you're forcing people to get a vaccine. Will you reprimand Tanya Davies for criticising the government's policy on this, or do you support her right as a Liberal Party backbencher to share her views?
It's a democracy. I don't mind people expressing their views.
We heard about a fatality. A person has been, ambulance officers have gone to a house in Emerton and found a 20-year woman in her 20s has died from COVID. Have you got any information on that?
No, unfortunately I haven't, but we'd be happy to update you afterwards. But we were aware of media reports of that, and I haven't been able to confirm anything prior to this meeting today, the press conference.
Dr. Chan, just a question. Dr. Chan, a question that the Premier was asked earlier about whether or not we may have flattened the curve. Is it possible that we have seen the peak?
Can I just say, one day is not a trend.
It's 2 days that we've come down.
No. We're in here for the long course. I would love to believe that we're on the trend down. That would just give me joy. And can I just acknowledge how hard the health system and whole of government is working to support the community in the response. And my public health contact tracers and my public health units are working so hard. So for them and the community and for everyone, I hope the numbers are going to decline. But one day is not a trend. We have to all work so hard over these next couple of weeks. I'm actually not expecting to see the impact of the vaccine. So just let's be clear, the impact of vaccination takes a while. It takes at least 2 to 3 weeks for vaccines to work. And so the impact on transmission will not appear for 2 to 3 weeks. So we're obviously seeing some impact from vaccines that were given 2 to 3 weeks ago, and gradually those ramped up numbers. But this big push in southwestern Sydney, we're not expecting to see the impact of that until mid-September. And so that is why it's so critical that we work so hard now as a community. And can I also just say business? I'm really asking business to step up. You know, please don't have those tea rooms operating. Please don't. Just really review your COVID safety plans and do everything you can to keep your workers segregated and not mixing. Every little bit will help us if we have a workplace exposure. It will help your business keep operating, and most importantly, it will protect some of your staff from getting infected. And urge every one of those to go onto that New South Wales Gov website that Ms Pearce talked about and get vaccinated.
Dr. Chan, just this freedom that the Premier has promised people, are you comfortable to give at least one freedom to people who live in areas where they're having more than 100 cases a day still?
So I think the Premier's made it clear that what we're doing is working through all of the issues. And this is very, very complex, and I don't think it's appropriate that I just say something off the top of my head in a press conference. We are working this through in a very considered way, recognising the fact that the community has been doing the hard yards. And I just want to acknowledge the southwestern Sydney and Western Sydney communities who have been doing it harder than most, impacted by COVID, keeping our city going, and the fact that they've turned out for vaccinations and their vaccine rates have lifted. That we've got to get them even higher, and I would really like to see those LGAs of concern leading the table of the highest vaccination, and that would be very satisfying to me.
Can I just ask you about school HSC vaccinations? Well, I think there were 22,000 you were trying to vaccinate in a week. How did you go on that? And is there enough vaccine, Pfizer vaccine, to vaccinate the rest of the HSC cohort?
So just to answer that question, and again, I'm going to go back to vaccination and the opportunities. So for those 12 local government areas, there was vaccine offered to a number of high school students in a number of the LGAs. The LGAs broadened, but this is your opportunity. And it will pick up year 11s as well as year 12s, because some of year 11s are 16. Anyone 16 to 39 who live in any of these 12 local government areas, which are densely populated local government areas, are entitled to vaccine. There are bookings available. Ms Pearce has indicated there's 200,000 bookings available. Go onto the website now, get a booking, get vaccinated.
How many did we actually do in that week?
It was many hundreds.
I was going to say Dr. Pearce. Susan Pearce would know the exact answer, but I understand we did between 15 and 16,000 out of a cohort of 20, so it was pretty good. We thank all those HSC students that came forward and get vaccinated, and please note that time there would have been a number who would have been in isolation because their family members would have had COVID. But to get 15 to 16,000 kids done in 1 week was really encouraging. So for any other children, any other people between the ages of 16 to 39, you have priority in those local government areas of concern. And when we talk about the local government areas, obviously each local government area, just to make it clear for everybody at home, has lots of suburbs within them. So if you hear your suburb mentioned, please get on newsouthwales.gov.au. You have priority vaccination. So anybody between the ages of 16 to 39, come forward. Nearly 300,000 people have already taken up the call, and we only have have a few weeks to get everybody jabbed.
Deputy Premier, just for Dr. Chan, we heard in estimates yesterday.
Last question.
We heard in estimates yesterday that there will be almost 1,000 contact tracers in New South Wales soon. Are these roles that people can apply for across the state who are out of work and want to help, or are they mainly military that are being engaged?
I look at a variety of sources, and can I just thank government agencies that have previously helped us in the first wave have come on. We've obviously done recruitment. We've also looked at and called for staff across New South Wales Health more broadly, and also the private sector. So can I just thank a range of industries, a range of cross-government agencies and New South Wales Health for identifying them. Obviously, there is an issue that we have to train them to allow them to build up capacity, and certainly with the rising cases, but it has been a lot of work being undertaken.
Just in terms of risk, Dr. Chan, what's riskier? What poses more risk? A fully vaccinated hairdresser servicing a fully vaccinated client, or allowing people in Blacktown to go out of their house for exercise under strict rules for more than 1 hour a day? Which is riskier in that scenario?
I think I'll answer that question by saying we have a set of rules in place. They are amongst the toughest, and what we're at the moment doing is trying to drive those case numbers down. And we are also trying to increase the opportunities for access to vaccination and prioritising the communities of southwestern Sydney and Western Sydney where we know going into this outbreak they had lower rates of vaccination. So can I just say, please go to the website, get vaccinated. That's critical. Obviously, when we see those case numbers going down and vaccination levels going up, that will allow us to be more confident we have got control. The Delta variant is very, very challenging, and we need all the tools at the moment to keep those case numbers under control. And even then, I wouldn't be surprised, notwithstanding the fact that I really want them to be going down, if we see an uptick over the coming days. As I said, because the effect of the vaccination will not kick in until probably around mid-September in terms of that. Obviously, it's been progressive because we've seen that rapid increase, but in terms of this big slug of vaccines that we're giving into the workers in those areas, that will take 2 weeks from when we get them in. Ms Pearce done an incredible job with New South Wales Health to get those systems up, but it will be probably up, I think it concludes around the 3rd of September, 5th of September is when we get the final lot of that 530, and then we just need to have add 2 weeks to get the maximum impact from those vaccines.
Deputy Premier, just very quickly, has there been a concern about construction workers taking the virus into the region? I heard some comments you made this morning about this. Are you looking at changes to the rules here?
Well, as I said earlier, I mean, we've got a permit system that's just come into play as of Saturday. We've got a number of restrictions in the region you can leave Sydney. Yes, we've had a number of cases with construction workers in regional settings, in Orange, in Coffs Harbour and other settings, the Costco site at Toronto. So they are areas of concern, but at the same time we've got to allow those industries to continue. We've got strict requirements on industry in relation to testing and vaccination, and of course everything's up for consideration. If there continues to pose a great risk to the regions, it's something that I'll take back to Crisis Cabinet, but at this stage we can manage it within the changes that we've made that have only just come in, and let it run its course. Thank you.
Thanks everybody. Thank you.